Good morning, everyone. Thanks for joining us. We're holding a press conference today to talk about the new information that is emerging about the Omicron variant in COVID-19 vaccines. Dr. Stephen Goldstein is a postdoctoral researcher at U of U School of Medicine. He's also a virologist, and he is here today to talk about the latest developments of what's going on. Dr. Goldstein.
Thanks, Kylene. So I'll just start out with a brief overview of the Omicron situation in the United States, in Utah, and a little bit about the preliminary information we have on vaccine efficacy against Omicron. So I know the CDC announced yesterday that Omicron was responsible for 73% of infections in the United States at this point. I would emphasize that the confidence interval on that estimate was wide, anywhere from 34 to 95%. And I think there are still some significant differences around the country, depending on where you are. So the best information we have for Utah right now comes from Intermountain Health, which is the only major testing entity in Utah that's using a test that can rapidly screen for Omicron, so doesn't require waiting for viral sequencing from the Department of Health. And that was that as of yesterday, roughly 30% of the tests that they were running statewide were coming back as probable Omicron cases. And so even if the that's in line with the lower end of the CDC estimate, it's obviously less than the 73%, but the Omicron frequency we've seen in the UK, Denmark, and in places like New York City and Seattle now is doubling about every 1.5 to 2 days. So that 30% number puts us only a couple days behind the national number of 73% that was estimated. So Omicron is here and it's rising in frequency rapidly. As far as vaccine efficacy, so the best estimates we have on this right now are still preliminary. They come from South Africa and the United Kingdom, and they suggest that due to the large number of mutations in Omicron, the protection against symptomatic infection, so that's infection with any symptoms, anywhere from mild to severe, has dropped to somewhere in the range of 35% for Omicron, compared to something like 65 to 70% for prior variants of SARS-CoV-2. The protection against severe disease remains significantly more robust, somewhere in the range of 75% based on preliminary estimates from South Africa. That is down from somewhere in the range of 95% against Delta, but is obviously much better than the protection against any symptomatic infection at all. Estimates from the United Kingdom suggest that are consistent with a drop to under 40% vaccine efficacy against symptomatic infection. And this is for 2 doses of mRNA vaccine, so Pfizer or Moderna, that make up the majority of vaccines that have been used in the United States. But the booster, preliminary evidence is that a booster dose raises that vaccine efficacy against symptomatic infection to 70 to 75%. So a significant benefit from getting a 3rd dose of mRNA vaccine if you've had 2 previously. We don't have much data for the Johnson & Johnson vaccine, the single dose, but we do expect the efficacy of that vaccine against Omicron to be significantly reduced, and would absolutely recommend that people who have received that vaccine go ahead, follow the CDC recommendations, and get an mRNA booster as soon as they can at this point to raise their protection against infection and severe disease from Omicron. So I think that's a general overview of where we stand in Utah nationally with Omicron and the best estimates we have for vaccine efficacy right now. So I'm happy to start taking questions.
Can you hear me?
Yes.
Okay, I'm Alfredo from Telemundo, and I don't know if you already talked about the situation in Utah, but I would like to know if the military is going to act within Utah going to hospital again. Can you repeat that part for me, or I don't know if I missed it?
So I don't know anything about what kind of military involvement there might be. I know that our hospitals in Utah, the ICUs are pretty full right now. So any rise in hospitalizations is going to put significant additional pressure on our hospital systems. The Omicron frequency is rising rapidly in Utah. So the data we had from last week from Intermountain Health on Friday was that Omicron was probable Omicron cases were representing about 6% of the tests they were doing. As of yesterday, that was up to about 30%, which is consistent with around a 1.5 day doubling time for Omicron, which is a little faster than we've seen in other places, but not by much. The estimate, for example, in Seattle was that Omicron was doubling about every 1.8 to 2.2 days. So we may be moving a little bit faster than that, but that data may also be a little bit noisy. I think we're in the range of 1.5 to 2 days doubling time for Omicron. So if it was 30% yesterday, I do expect Omicron to be dominant in Utah by the end of this week.
Can you do a comparison between the Delta and the variant in terms of growing or infection? Very brief.
So Delta infections in Utah are decreasing right now. I think as of yesterday, we're below 1,000. Our rolling average, 7-day average, was below 1,000 cases per day for the first time in several months. I expect Delta infections to continue to fall, but I expect Omicron infections to continue increasing, and potentially as soon as next week, we'll start to see rising numbers of total infections again as Omicron takes over from Delta.
Thank you, Dr. Goldstein. So who identified Omicron a variant of concern in late November? It hasn't even been a month now, and it's being labeled as the dominant variant. Is this the fastest we've seen a variant spread in communities so far?
Yeah, it is. We haven't seen a variant spread quite as quickly as Omicron has before. In Wuhan and New York City in late 2019 and early 2020, we did see doubling time similar to around 2 days, but that was in a completely susceptible population and basically without any realization that the virus was even spreading at that point. So what we have basically is a rate of spread that's comparable to the earliest days of the pandemic, when we didn't have any protection from population immunity, either due to prior infection or vaccination. So I would say that Omicron is spreading faster than any previous variant we've seen. Delta took several months to reach this high level of frequency after its first detection globally. And Omicron, as you mentioned, has done that, not globally yet, but within a matter of weeks, gone from 0% frequency in the UK to 90% in parts of the UK, and quickly moving towards dominance here in the United States and Utah.
If I might hop in, it's Pamela McCall from KUER. Thanks so much for holding this. Question for you concerning Christmas gatherings, holiday gatherings, given the rapid increase of Omicron, if you could speak to that.
Sure. So there's obviously, with the rapid rise in Omicron infections, there is an increased risk this year associated with holiday gatherings. I will say on an individual basis, the protection against severe disease with Omicron is still pretty good, albeit reduced significantly from the protection against severe disease from Delta. I think people who have been boosted can feel very comfortable that their protection from severe disease will be very strong. It's not going to be absolute in terms of protection from infection. If you've had 2 doses of vaccines, I would recommend, and I understand that the availability unfortunately has declined, but rapid testing, if you have the possibility to do that as close as you can to before you get together with family or friends, is certainly advised. But there is a significant risk of the holidays increasing the spread of Omicron. We saw that last year, spikes after both Thanksgiving and Christmas, and I think we can expect to see something similar this year, unfortunately.
What is that going to mean for hospitals in Utah? And will people be as sick potentially as they were with Delta, or is it milder?
So it's clear that South Africa hospitalization data is pretty clear at this point that the rate of hospitalization during the Omicron wave they've had there is lower than during their prior Delta wave. What's unclear is to what degree the population immunity in South Africa is playing with that. So South Africa is only about 30% vaccinated, but something like 90% of the population was infected in their prior waves caused by the Delta and Beta variants. And so there are very few people in South Africa who are completely naive to this virus in terms of their immune response. In Utah, we do have a pretty substantial amount of population immunity through vaccine and prior infection, but we do have a large number of people still in this state who haven't been vaccinated or previously infected. And we don't have a good understanding of what the severity of Omicron will look like in that population of people. And as I mentioned, I'm not a clinician, so I can't speak in too much detail about the hospital situation here, but I think and I don't have detailed numbers for the U specifically, but in Utah, ICUs are still something like in excess of 95% occupied. So even if the Omicron wave in general is milder, we don't really have any breathing room in our hospital systems right now here in Utah. So even a fairly modest increase could put a lot of stress on the hospital system.
Thank you. Could you speak to the symptoms and how they differ with Omicron?
So I don't think we have a great understanding of this yet, but what's clear is that mild infections have symptoms similar to other respiratory viruses: sore throat, cough, congestion, runny nose, fever. So, even if you're vaccinated and boosted, if you come down with those symptoms and you have plans to spend time this holiday season with vulnerable family members, so people who are older, have any kind of immune compromising condition, I would avoid doing that. If you come down with those symptoms, even if you don't have access to a rapid test, assume it could be Omicron and stay away from vulnerable people. If you have low risk people in your family, if you have symptoms, I would stay away, but we'd be less worried from a individual health outcome in people who are young, healthy, and vaccinated, and especially boosted. Are we taking questions from the chat as well, Kylene?
Yes, I'm honoring that. How important is testing during this time as families are getting together and Omicron is spreading? I know you talked about that, but can you also talk about whether at-home testing is worth it?
Yeah, so at-home rapid testing, if you have that accessible to you, is great. And I would do it as close as possible to when you're going to get together with family or friends. So, even an hour before you go, take the rapid test if you have it at home. And if you test positive, obviously don't go. And I understand that from my own experience that these tests are getting difficult to find here in Utah now, as they are nationally. PCR testing a couple days before you get together with someone, unfortunately, is not of great utility because a lot can change in those 2 days, say between when you get your test and when you get together. So I would use rapid testing to the extent possible and be very cautious, even if you have mild symptoms, staying away, especially from vulnerable family members.
Okay, a question from Christian. Dr. Epstein talked about Omicron reducing antibodies. What about T cells? Do they hold against Omicron?
So this has been looked at, and the Omicron mutations have some effect on T cells, but about 70% of the sites on the Omicron spike protein that are targeted by T cells are not disrupted by mutations that we see in this virus. And so T cell responses in general should remain fairly intact against Omicron.
Thank you. A Facebook question. What about those 5 to 11 who are recently vaccinated with 2 doses? What does that mean for them and their protection?
So the more recent your vaccination, the more effective the protection from that vaccination is going to be, because we know that antibodies wane over time. I think the 5 to 11 population, especially if vaccinated, is extremely unlikely to have a severe infection if they do become infected with Omicron. But the protection from 2 doses against Omicron is from infection is fairly limited. So I would expect that people with 2 doses are at a higher risk of infection this holiday season, a lower risk than last holiday season when we didn't really have any vaccine availability at all, but at higher risk than they were with the Delta variant. But clearly, this is a very low risk age group when it comes to severe disease.
Okay, got a question from Morgan Wolf. Is there a particular concern around babies and young children getting Omicron?
So the concern would be with as transmissible as Omicron is, it's going to be more difficult for anyone not to get Omicron. In general, young children have a very low risk profile from infection with SARS-CoV-2, whether it's, and other variants. We don't have good data on Omicron specifically yet. I don't expect it to be significantly worse than other variants in that respect. The only exception with young children is that children 0 to 1 have had a higher hospitalization rate throughout the pandemic than slightly older children, slightly older young children, but that's still substantially less than, for example, adults over 65. But it makes sense if people are going to be in close contact with infants to make sure you wear a mask, use rapid testing to the extent possible, things like that.
Thank you. From Sean Means with the Salt Lake Tribune. Early indications from South Africa was that Omicron spread faster, but had generally milder symptoms than Delta. Has this held up, or is Omicron as likely to produce severe outcomes as Delta was?
So in South Africa, as I mentioned, the hospitalization rate with Omicron has clearly been lower than during the Delta wave, but we don't understand yet how much of that is simply due to the very high residual immunity from prior infection in South Africa, where over 80% of the population was previously infected during the preceding 3 waves that they had there. So the protection from reinfection, Omicron has a very high propensity for reinfection relative to prior variants, but we expect that protection from severe disease due to prior infection will remain quite strong. And so that may be responsible for the observation of reduced severity with Omicron that we're seeing in South Africa. We don't know what the severity of Omicron will be in immune naive individuals, which we still have a pretty large population of here in Utah. And we don't have very good information on that from either the UK or Denmark either, where the vaccination rates are higher than the United States. And they're not that far ahead of us. So the hospitalization information from those places is not really available yet. I think we should err on the side of caution with Omicron severity, particularly if you haven't been vaccinated or infected previously. If you have been vaccinated, the risk of severe disease is pretty low, but not zero. I mean, the first reported Omicron death yesterday in Texas was in someone who had been previously infected but not vaccinated. So that protection is not absolute. And Omicron certainly has the capacity to cause severe disease.
I'd like to ask a question. I'm Lincoln Graves with KUTV. What would you recommend for older adults or senior citizens who are vaxxed and boosted, but they may be gathering with large families where that isn't the case for some of those family members?
Yeah, so I mean, there's a personal risk calculation here, obviously. I think people who are vaccinated and boosted, even older adults, are likely to have pretty strong protection from severe disease, but that protection is likely less complete than it is for younger people. So it would certainly be recommended if possible for, say, vulnerable people to remain masked during gatherings to the maximum extent possible. This is a really good time to think about upgrading mask quality among all individuals if you're going to be indoors in a setting that's amenable to wearing masks. So I obviously understand if people are eating, having family dinners, they're not going to be wearing masks while they're eating, of course. But other settings indoors where it's feasible, wearing masks like KN95s or KF94 masks is definitely advised over cloth masks. Even a surgical mask is better than a cloth mask. And older vulnerable individuals, to the extent that they can remain masked, is certainly a good idea.
So do you consider older adults and senior citizens who are vaxxed and boosted also still to be vulnerable?
I think they're much less vulnerable against Omicron than they would have been against without vaccination, clearly. All of the data we have on Omicron so far is fairly preliminary because it's moving so fast. We've only known about this variant for less than a month. And we don't have great age stratified data from South Africa, for example. So I would consider those people more vulnerable than other age groups. But I think the protection from severe disease is likely to be pretty robust in that population, but less than, say, the 95% that we saw with Delta or previous variants. So I think a little bit of increased caution is warranted in senior citizens.
If I might again, thank you. What's your best advice for people that are riding that are skiing this holiday and are riding in trams and gondolas?
Yeah, so my advice would be, certainly if you're riding a tram, like skiing at Snowbird, to wear a mask in the tram. The windows on that thing open, so ventilation is a great protection against SARS-CoV-2 infection. If you have to go indoors into the lodges, I would certainly wear masks. I would also note that our hospitals are pretty full already. So, maybe that can affect the amount of risk that people take on when they're skiing. It's a good time to stay out of the hospital for any reason, I think. If you're in a lift line outdoors or riding the lift, I think those are pretty safe settings. Yeah.
Thank you.
Sure.
Dr. Goldstein, if someone was to get a booster shot today, what sort of protection would they have if they gathered with their families for Christmas?
Yeah, so unfortunately, we're a little close to Christmas for that to have a big impact. But if you can go out and get one today, I think we probably start seeing a benefit from the booster doses in as little as a week post administration. Certainly, the data we have from the UK is 2 weeks or more, where I said that we have 75% protection from symptomatic infection. That's 2 weeks or more from the booster, but I think you probably start to get some benefit in as little as a week. So Christmas is too soon, but New Year's is not. And I think, although cases are going to start going up probably next week here in Utah, the real explosion is going to be in January. So going and getting a booster right now before Christmas is definitely a really, really good idea for protecting yourself during what is likely to be extremely rapid transmission of Omicron in Utah in January. And we should brace ourselves. There are going to be a lot of breakthrough infections, but the more people who are vaccinated and the more people who are boosted, the less severe those infections are going to be, and the fewer deaths we'll see during the coming Omicron wave.
Just to add on to that, this is Lad Egan with KSL. If someone is completely unvaccinated and they're going to get vaccinated, when could they start having benefits from that, especially with planning a holiday gathering?
Yeah, so if you're completely unvaccinated, go get vaccinated now. I'm not going to sugarcoat it. The truth is that we don't really have much data on the protection against Omicron from, for example, one dose of vaccine, but any dose is better than none. So, go start your vaccination series as soon as possible. It will likely provide you some protection. The protection is going to be more limited than people who have had 2 or 3 doses, but it's absolutely better than being immune naive when you encounter this virus. And the truth is that a very large percentage of us are going to be exposed to this virus over the next 2 months. So any degree of immunity you can acquire before that exposure happens is a benefit.
Thank you. We have a couple questions from Facebook I'd like to get to. One of them is, should people plan on getting boosters every 6 months? And when can 12 and older get a booster?
So as far as how frequently we'll need boosters or additional doses, I don't know. We get flu shots every year, obviously. It's certainly possible that we'll be on that sort of regimen going forward with this virus. I think it's just too early to say still. In particular, we don't understand how durable the immunity from the boosters is. We do have some evidence that a 3rd dose improves not just the quantity of antibodies that people make, but the quality or breadth of those antibodies as well. So that 3 doses may provide better immune protection against variants we haven't even seen yet than 2 doses. As far as when 12 and up are going to get boosters, I don't know. I hope that the FDA and CDC are looking at that. Obviously, though, that age group in general has been vaccinated more recently than older individuals, which gives them some additional measure of protection. And they're in a lower risk age group as well. So I don't know if there will be as much urgency to get boosters into that population, but it's not a question that I have any insight into right now.
Dr. Goldstein, can you talk a little bit more about the recommendation from the CDC about mRNA vaccines and what this means for people who receive the initial J&J vaccine and they want to get their booster shot or maybe got their booster shot?
Yeah. So the CDC and FDA, I think it was late last week, did recommend that the mRNA vaccines be used preferentially over the Johnson & Johnson vaccine in the United States. It's clear that the mRNA vaccines provide better protection against variants. Probably the mRNA platform is a bit more effective, and the 2 doses versus 1 dose is more effective. And I think they recommended that if you had your J&J vaccine more than 2 months ago to get a booster, I would just go get an mRNA shot if you had the Johnson & Johnson vaccine. I think they're recommending just 1 for now. Personally, I think 2 doses of mRNA are warranted after if you were initially vaccinated with 1 dose of Johnson & Johnson. And this is just a numbers game. You know, we're talking about people with mRNA vaccines getting a 3rd dose, 3 exposures essentially to the SARS-CoV spike protein before you hopefully encounter the virus for real. And so I think that number of exposures matters. So if you can get 2 doses of mRNA vaccine, even if you had a Johnson & Johnson, I don't think it's a bad idea. But certainly in line with the CDC recommendations, absolutely get a booster as soon as you can.
I have another question, if I might jump in. President Biden is to announce new measures in just a couple of hours. What will you be listening for in Utah? You mentioned the shortage of rapid tests and that perhaps we should be wearing better masks. What will you be listening for from the president that would affect Utah?
I think those are 2 major things. So my understanding is that the government is planning an initiative where it'll be possible to go to a government website and get rapid tests sent to your house. This is an absolutely great idea. I don't think the number of rapid tests, the number I heard was 500 million. So obviously that's only a little bit better than 1 per person in the United States. One thing I'd be listening for is whether the government is concurrently making any efforts to rapidly increase the production of rapid tests. We just need more of them. We need them in stores, in pharmacies, and not empty shelves. So that would be one thing to listen to. Another thing would be the guidance on masks and whether the government would set up a similar effort to get people reliable, high quality masks if they can. You know, for example, KN95s are great masks and really comfortable, but a huge percentage of them that you can get online in the United States are fake. So to the extent the government could potentially centralize the production and provision of high quality masks to people would be another thing that I'd be listening for from the president.
Thank you.
Dr. Goldstein, what do we know about monoclonal antibodies and their effectiveness against Omicron?
Yeah, so unfortunately, the mutations that Omicron has in its spike protein have a huge impact on monoclonal antibody effectiveness. So the monoclonal antibody cocktails from Regeneron and Eli Lilly that have been most widely produced and used in the United States are not effective against Omicron. And so we're going to start to see decreased use of those monoclonal antibodies. The only monoclonal antibody that's commercially available that's effective against Omicron is the one produced by Vir, a company called Vir and GSK. The availability of that is very limited. My understanding is that some is on the way to Utah right now, but it's going to be given out very carefully because we simply don't have enough nationally for everyone who would have been treated with monoclonal antibodies if we were still dealing with, say, Delta. To go back to the last question, another thing to listen for from the president would be if there's going to be any sort of crash program to increase the availability of this monoclonal antibody over the next weeks and months, because we're going to need more of it.
Dr. Goldstein, I have sort of I guess I'm looking for your personal perspective, given what we've seen over the past 2 years, given what you know now, how worried are you about this coming wave?
Yeah, so I'm worried. This cuts both ways. I think if you have been vaccinated and boosted, from a personal standpoint, you do not have to be overly concerned about getting severe disease yourself. However, in the United States, and especially in Utah, there's a large population that has not been vaccinated and boosted. And even a large percentage of those people who have not been, there's still a large percentage of our population that is, what the term I used was, immune naive, has not been exposed to either the spike protein through vaccination or through infection. And I think that population is in for a difficult couple of months, and there's the potential for a high rate of hospitalization in that population. We're all hoping that Omicron is milder in people who are immune naive, but we really just don't know yet. And at a system-wide level, I'm concerned because our Delta wave is just starting to come down in Utah over the last couple of weeks. The hospitals are still pretty full. And so even a fairly modest rise in hospitalizations from Omicron has the potential to swamp our system again at a point where resources, including personnel, are pretty exhausted and reduced from earlier in the pandemic. And, you know, even with a substantial amount of protection from severe disease in people who are vaccinated, there are going to be a lot of breakthrough infections, particularly among people who have only 2 doses. And so, you know, older individuals who have had only 2 doses are at a higher risk of those breakthrough infections being severe than younger people. And so I think that remains a concern as well. So, you know, it's a complicated picture. On the one hand, I'm very concerned that we're going to exceed our previous peaks in number of cases, slightly optimistic about the potential to not have as grave an impact from the standpoint of deaths.
It looks like we don't have any more additional questions. If you do have a question, you could unmute and ask quickly. If not, otherwise, I think we are going to wrap this up. Thank you everyone for joining, and thank you for your time today, Dr. Goldstein. We appreciate it.